Hi, everyone. My name's Marta Shore. As Gail said, I'm a co-chair of the Biostatistics Community Outreach and Engagement Committee, and I'm here to talk about our work. BCO was formed in 2020 to both encourage K-12 students to consider careers in public health so that we can ensure comprehensive, compassionate, and culturally aware public health professionals, and to create age-appropriate activities related to biostatistics and provide trainings for teachers around public health. In fall 2020, we connected with teachers at Coon Rapids High School. Since their class was virtual, they needed a research project that could be performed online. We collaborated with the teachers, Ann and Luke Dillon, to create a project where students performed medical research in a virtual world called the Islands. The high school students create a research question, do a literature search, create a study design. Our graduate students and faculty consult on the design, ensuring they have a large enough sample size and that their results can be analyzed easily. The high school students collect the data, perform the analysis, and present the results to us, and we give them feedback. The Coon Rapids teachers shared with us this feedback about our work. Many of our students will be first-generation college students, and they may not have met a graduate student before. Now they know a biostatistician. Now they are more able to sort out truth from data. We have also collaborated with St. Paul Public Schools. Our strategic plans align on curriculum development. Our strategic plan calls for developing and delivering K-12 programming to expose students to the field of public health, and their strategic plan calls for developing effective and culturally relevant curriculum. We worked collaboratively with high school teachers in St. Paul Public Schools to develop an air quality app for their earth science course. The teachers shared their curriculum goals and what students would find most useful and engaging. We found the relevant data and made a web applet where students could choose what to explore and statistical concepts were explained in plain language. Students can find the air quality monitoring station closest to them and can compare their air quality to other locations around the state. They can see the impact of both natural phenomena and human activity on air quality in Minnesota. For example, in 2021, one student noted that the air quality reached unhealthy levels on July 4th, 2020. They noted air quality was not as bad on July 4th in other years when municipalities held fireworks shows. The strategic plan also aligns around career pathways. Our strategic plan works for working with local high schools that have high populations of students who are historically oppressed, disenfranchised, and underrepresented in public health. Their strategic plan calls for ensuring students know about opportunities they may not be familiar with. In spring of this year, we hosted curriculum professionals from SPPS, faculty, staff, and professionals from our DEI, communications, and career counseling groups all shared their career pathways and how their work is integral to our school and our mission. We also created ways to connect by seating our guests with students from all 4 divisions so they could meet our future public health workforce. Finally, we shared learning resources with our guests. One teacher said normally these presentations are aimed at the teachers and are less about presenting materials that would be of interest to their students. He said the content of our presentations were accessible for student-level learning. Our work did start with career panels. We started with a career panel at Gap, a middle school in St. Paul Public Schools. At their career panel, students first wanted to connect with us and understand us as people before they heard about our work. So when we do career panels, we start with who we are and why we do the work we do. Students really want to know who we were like when we were their ages. So we start with who we were as kids and teenagers, what motivated us, what we enjoyed doing, and what we wanted to do as a career. Then we talk about who we are. We talk about our values and our strengths. For many of us, our path to our career in public health wasn't clear when we were younger, but is the perfect fit for us now, and we share why. We've noticed that students want to not only do good work when they grow up, but they want to also lead a good life. We talk about job security, work-life balance, and making enough money to support a family and help those that we care about. Only after students connect with us and learn that a career in public health is a viable option for them do we share the work we do. We find students are more excited about the work once they connect with us as people. We have learned through all of this work that collaboration is key. Our work is expanding through on-campus collaborations with the Cancer Center, College in the Schools, and the core team in the OED office, who all have programs targeted at high school students, their teachers, and their families. Finally, we have learned that students often assume biostatistics and data science are not for them. We show them that not only can they understand data, but they can use data to understand the issues they care about. That's when they see themselves as biostatisticians.